And Joni, the dental assistant, is always 2 or 3 steps ahead, so she's going to get the topical anesthetic prepared. She's passing the topical with the 2x2 gauze, and the aspirating syringe is going to be next. Once the anesthetic is given, then a thorough rinse of the tongue and oral cavity will be given, just to alleviate the patient's mouth from the bitter taste of the anesthetic. About after 10 minutes, the dentist will come back into the operatory and we will do the cavity prep. The dentist switched from the high speed to the low speed. Maybe the cavities go deep into the pulp, so we're going to drill out some more cavity with the round burr and the slow speed. Perhaps she'll need the spoon excavator next, if it's getting really close to the pulp. And the dentist will ask for it if she needs it. Joni is grabbing for the spoon excavator. Okay, so the cavity prep is done. Joni's going to rinse the tooth really well and dry it. And now we have to isolate this tooth very well. The most common isolation technique that we use in dentistry is cotton rolls. So we're going to use cotton roll isolation today. On the bottom, you always get 2 cotton rolls, one for the lingual side and one for the buccal side of the teeth. After this, the tooth is ready to receive the medication. So Joni is going to mix the Dical. Dical is a calcium hydroxide that's used to promote the growth of secondary dentin. And she will clean the instrument before actually giving it to the dentist. And take the liner applicator and the Dical as close to the patient as possible and to the dentist, so the dentist does not have to reach too far. And the instrument may need to be cleaned as we go through this step. Then the next medicine that we'll be using is the Copalite, which is a cavity varnish, and that is used to seal the dentinal tubules so the tooth is not so sensitive. After this step, we will place a little fence around the tooth called the matrix band, the Toffelmeyer and the matrix band, and wedge. We want to make sure and cover all the materials in case there's this accidental spill. We want to just make sure to avoid that. So now Joni mixed the amalgam, and we're going to get ready to place the amalgam into the cavity preparation. So Joni's getting the amalgam capsule out of the amalgamator.
use something from the designer.
Joni is getting the amalgam carrier and filling it up with the amalgam. The small end and then the large end, and both will be handed. Immediately following this step, the condenser is used to pack the amalgam into the cavity prep. And this step will go back and forth until the cavity is filled to the top.
Do you need some more? No, this looks good.
We're going to remove the wedge and the isolation and the matrix. And then we are going to do the interproximal carving and then the occlusal carving. So the hollow back will be used first and then the discoid cleaving. Then we will check the occlusion. And the discoid cleoid may need to be used again if the restoration is too tall or too high. And this step may need to be repeated a few times.
Okay.
And we're going to floss the tooth to make sure there's no overhang of amalgam in the interproximal contact. We'll burnish the tooth after this. Burnishing is done to polish the amalgam. And we'll do a final rinse. And Joni will give post-operative instructions today.
Mr. Seymour, we are now finished with your amalgam and do not eat for the next 2 hours. You may, due to numbness, and you may experience some sensitivity to temperature, and eat on the opposite side for the next 24 hours, and I will meet you in the front office. Thank you.